So one of the most common questions that I get from people when they hear that I work with lymphedema, and also from my patients when I first see them, is what causes lymphedema? There are many answers to that, and in this video, I'm going to focus on one because that is the most common one, and that is obesity. Now, when I got my lymphedema training many years ago, we were told that obesity could be a risk factor, meaning that it may contribute to lymphedema along with other things. But since then, the wording has changed on that, and we now know that obesity can cause lymphedema. We've always known that there's been a correlation between the two. That's been obvious, I think, to anyone that works with lymphedema. We've seen it. But now that we're learning more about how the lymphatic system works, and we can see that the obesity may actually not just be a correlation, but even a cause in itself. And I've seen that in my experience, where I've seen many patients that really didn't have a lot of other things in their history that could explain it. So bear with me. I'm going to show you some PowerPoint slides and try to explain the connection between the two. Go. So we're going to talk about obesity as a cause for lymphedema, but I'll tell you what some of the other common causes for lymphedema is. It can be caused by surgery, venous insufficiency, and I'll have another video on that coming up. Insulin resistance, and I'm going to make a video on that too. And also can be caused by cancer treatment. So there'll be other shorter videos on those topics, but today we're gonna focus on obesity. So what is lymphedema first? It's when you have swelling of a limb. It could be legs, arms, anywhere, and it's caused by the fact that lymph vessels are not able to drain the fluid fast enough. So super quick, what a lymph system does, if you're not familiar with it, they're vessels like these green ones here, and what they do is they transport fluid throughout your body. So if you stomp your foot and you have a swollen foot, it's the lymphatic vessels that has to move that fluid out and into the blood eventually so that it can leave your body. So it's like a plumbing system of the body, and that helps to understand the connection between lymphedema and obesity. Most of what you see in this picture, these green lines and these little dots, the lines are vessels, the dots are lymph nodes, and they are in the surface of the skin. There's lymph vessels everywhere, but most of our lymph vessels and lymphatic activity is in the skin and in the gut. So now you might begin to see where it may connect to obesity. So, and the thing with obesity and lymphedema is that they're a little bit of a downward spiral, you can say. One causes one, and then that causes the first one. So when we have obesity, when we have excess body fat on our body, that causes lymphostasis. That means it causes the lymphatic vessels to not move fluid as good as it should through the system, so fluid backs up. When fluid is backed up, meaning you have lymphedema, that signals the body to store more fat around that swollen limb. And they've seen this, for example, with people that have swelling in just one limb. So let's say the right arm has lymphedema, maybe for a different cause, surgery or something, the left arm doesn't. And then if you do a cut through and you were to look at that arm, you can see that there's more body fat in the swollen arm as well. So having lymphedema causes more fat accumulation in that limb that has the swelling. So it works both ways. So why does obesity cause lymphedema? One of the reasons is simply mechanics. So if you have a soft plumbing system, they're like little rubber hoses that are supposed to transport fluid. Like, you know, if you kink a hose, it's not going to flow very good. Or if you put a lot of pressure on a soft hose, it's not going to flow. So when there is excess weight, and if you have folds, or if there's a lot around the abdominal area, for example, if you lie flat, the weight of that is going to pinch off in some very critical places for the lymphatic system. So part of it is just simple mechanics. Inflammation often comes with obesity, and inflammation overloads the system. So not only now do we have a system that has a hard time moving fluid, but it also has more fluid that it needs to move, because the lymphatic system is very much involved in removing inflammatory stuff. It's not just water, but it's all the other stuff that needs to be removed. Like I said, if you stomp a foot, there's going to be some inflammation, and the lymphatic system needs to be able to move that. So if you have inflammation, which you are more likely to have when you have, if you're overweight, then the lymphatic system becomes overburdened. So now you have a system that doesn't work as good, and it has more work to do. Venous hypertension is often also correlated with obesity. So now we add that to the mix. And like I said, I'll do another video on that, but that is the second biggest cause of lymphedema, but after obesity, but they often come together. Often, if you, depending on how obese someone is, obesity usually causes someone to be less active. And that's another one of those cycles. If we're less active, we're more likely to be obese. And if we're obese, we're less likely to be active because it's more difficult to move. And the lymphatic system needs muscle activity to function properly because, and again, that's mechanics. A muscle that moves manipulates and massages the lymph vessels, and that keeps that fluid moving. So if we're more sedentary, the lymphatics aren't going to move as fast through our system. And then another topic is insulin resistance and diabetes, which is really kind of a root cause for many of the chronic illnesses that are very common in America and in the Western world. And it's very much correlated with obesity. So that also contributes. And insulin resistance in itself is also, you could say, bad for the lymphatic system. There'll be another video on that because that's a topic of its own. So, and I mentioned that then you get that spiral where having lymphedema then causes more fat accumulation in that limb. So I know that's sort of a sad story. It's a story of a downward spiral. So I want to end with an upward spiral, because I always want to leave hope at the end of these videos, because there is hope. These things are not irreversible. If we are spiraling downward, it is also possible to spiral upward. So what can we do if we have obesity and lymphedema? And when I say this, I base it on true experience from the clinic. I have seen many people turn this spiral around and turn it into an upward spiral, people that I have worked with. And so I believe it's possible for you too, but it's not easy. It takes a lot of work. Step one, you have to find a good lymphedema therapist that can work with you on reducing the symptoms of the swelling. We got to get that swelling down, because the swelling can cause many other problems like wounds, infections, draining, all kinds of things. So that's our acute approach, is to get the swelling down, and a good lymphedema therapist will know how to do that. The main ingredient of a good lymphedema therapy program is compression. If you find a therapist that only wants to massage and doesn't want to use compression, then go look for another one. Step two, you got to maintain that swelling. So a therapist can help you bring the swelling down, but you will have to keep that swelling down. And again, the number one ingredient in that is compression. There'll be more videos on more details on a good lymphedema program, but if it doesn't include good compression, it's not a good maintenance program. So now you're in maintenance, you're keeping the swelling down. Now you can begin the long-term process. And we recommend a ketogenic lifestyle. Ketogenic meaning low carbohydrate way of eating. And if you can join a program that helps you along with that, would be good. And absolutely let your doctor know what you're doing. You always want to have your doctor on board if you do something like that. But that is effective in helping weight loss, and it's also been shown to improve lymphatic flow in itself. So as you begin to lose weight, your lymphatic system will become healthier. And as you feel better, you are more likely to start becoming more active. As you become more active, you're probably more likely to start sleeping better. And this is the upward spiral I'm talking about. So then, just like it can spiral downward, it can spiral upward. So it's worth to begin. And I think the best time to begin is now. And if we can be a help of you along the way, subscribe to this YouTube channel and check out we have a couple of websites and different programs, so check all that stuff out too. And I wish you the best of luck. If you are one that's suffering with this, first of all, it's not your fault. And second of all, there are things you can do to improve it and start an upward spiral. I wish you the best.